So thank you for those wonderful presentations from our exemplary speakers. I noted a few questions from the Q&A. So let me just go to them because thank you for sending out your questions. I'm assuming I should read them out for you because you did not raise your hands. So the first question is directed at both of you. It's actually two questions. So one is, what are the safety protocols that you undertake when you do anthropological research, when you work with communities? So that's the first. I'll send you a couple of questions before we get to your responses. And then the next question from the same person is, what is the purpose or motivation of conducting research on drug use and harm reduction? What happens to the data that you gathered, and whether you also do research not specifically on people who use drugs, but the people around them who do not use drugs, like families who are not drug users but have to live with or deal with people who use drugs in their environment.
Well, yeah, I can start.
Sure.
Safety issues. So, not all street-based drug use research involves safety issues. There aren't necessarily problems at hand. We have these notions that drugs and crime and danger are all intertwined. So first thing I want to say is that it's not always true, right? When it is true, when our team goes into places that do feel a little bit challenging, a little bit disturbing, we do have some rules. We always go in pairs, and we always stay in communication. We have techniques and government documents that get us out of trouble, or theoretically will get us out of trouble if we were to get into trouble. But mostly we have a power of our hearts and our compassion. I often joke with people. It's like, between this telephone pole and the next telephone pole, I'm going to ask you questions that no one has asked you before. And at the end of that, you can decide whether you like me or whether you think I'm a cop or think that I'm going to harm you. And we go in different directions. So most of the time, we just talk our way out of it. So that's safety protocols. As far as what we do with the data, so the purpose, as Gideon mentioned so eloquently, and a bit in my talk as well, the purpose of research is to try to change policy, right? It's try to change the way we do things vis-a-vis this highly marginalized, highly stigmatized population. And so I publish data by any means necessary. I will talk to reporters. I will get in front of a TV camera. I will go to government meetings. I will write papers. What academics usually do is write a lot of papers. But as I've gotten older, I've tried to move beyond just papers to get myself into the halls of power and talk to people and present matters from the heart, right? Because ultimately, that's what we're doing in ethnographic research. We're trying to get to the heart of the matter. A lot of researchers, a lot of policymakers, they kind of skip around and go to the safe margins of a problem. They don't really want to get to the heart of it, right? And what we want to do is get to the heart of it, to humanize the affected population, to speak, to give their voices some bandwidth, some power, and to try to affect change. Do the families around those folks matter? You betcha. Of course they do. Not necessarily part of my research, but it can be part of sociological research to understand how the drug problem is not just within the user, but within the communities. The solutions are going to be at the community level, so why not look at the community? Why not look at the family structure? With that, I'll zip it a little bit and let Gideon speak.
Thank you, Dan.
Thank you, and really thank you for listening to us here and throwing out these important questions. I definitely agree that we need to explore not just people who use drugs, their everyday lives, but the people around them. And that's become especially vital in the Philippines, where you have people, communities who are not even using drugs and yet are targeted by punitive drug policies. So as my supervisor, and when I was doing a PhD, Anita Hardon once wrote, drug policy was never about people who use drugs, but it's about people in power and how they try to construct certain policies that are not necessarily responding to the needs of the people. So I would definitely include families, people who use drugs, communities in the research agenda. I myself have not been able to do this. So just to let you know that the research that we're doing now, we're trying to do rural drug use in rural areas. We're trying to explore drug use among middle class individuals, and also because most of the research that I've done has focused on young men in urban poor communities, but there are many, many other drug contexts. So we need to build a community of researchers. This is not something that's impossible to do. We can really do this. I mean, I invite all of you to join me in pursuing this kind of research. Very vital that we do all of this because it dignifies people. So also to answer the question of why we do this, I think it's very important to assert that people who use drugs is more than just numbers. It's more than just a prevalence of how many people are using this or doing that. These are people. Their lives are complex. We cannot reduce them to their drug use. We cannot reduce them to problematic drug use even. So by doing research that puts them at the heart of it and allows them to give voice not just to their what they think but also their everyday lives, then we dignify people. And at the heart of research is anthropological and sociological research, I think, is human dignity. Now the second purpose of this is to lead to contribute to policy change. Many policymakers, we know that it's so challenging and so frustrating to do policy reform, but research is part of the building blocks to get people talking about these things, to get senators to listen, to get the first bill drafted, to have a citation in some human rights document that, hey, this is the lived reality of people. So maybe a single paper wouldn't mean a lot, but if we do this together and if there's a sustained effort to document drug use and to counter the discourses of people who think of drug users, people who use drugs as addicts or zombies or subhumans, then it's meant a lot. I have seen my own work cited in human rights documents that challenge the current drug policy. So I do not want let's not underestimate the value of the work that we do, especially if we do it together and we work with people who use drugs themselves. We work with NGOs. It can be done. And I invite you to join me in doing this.
Thank you, Gideon, for those responses, and Dr. Dan for those responses. Earlier, Dr. Gideon mentioned about the harms that befall the communities who use drugs that he has encountered, and that they don't actually necessarily come from the drugs that they use. Would you like to expound a bit on what you meant by that, Gideon?
Well, for example, if you're a young person, one of the young people I met, and you want to embrace what they call bagong buhay or a new life. So you want to apply to a supermarket to work as a bagman or a porter or whatever. But then you have to to face a drug test. There's many requirements that exclude people who use drugs. So they're already afraid that they will be excluded. So they're already excluding themselves because they know that there's a risk of getting killed, of getting jailed, and we know the situation in jails right now. Some speakers in this conference have talked about jails. So it's not about drug use. So if you talk about this person and reach the conclusion that the reason why he has no job is because he's an addict, that's so inaccurate. In fact, the reason why he is economically challenged and deprived is because of all these conditions, these policies that have marginalized and excluded that person. So sometimes the policies themselves end up being more harmful, far harmful even, than the drugs themselves. Especially since in my own work, I saw how young people use drugs to cope with their difficult environments, economically and socially. And in that case, the policy recommendation would be to create enabling environments for people to have meaningful jobs, to have opportunities, economic, educational opportunities, so that they don't have to resort to all of these risky practices in the first place.
Thank you. And of course, we also saw the experience of the communities in the past 4 years where people do get killed for the simple reason that they are suspected to be using drugs. And that is the biggest harm of all, because it does not just affect the person who used drugs, if they actually did use drugs, but the families around them. My organization has also worked with communities of people who use drugs, and we've documented stories. And we're still providing some support to members of the community who need their kids to undergo counseling and to actually take anxiety medicines because their children have witnessed how their father was killed uh, by unknown assailants because of being a person who uses drugs. So the repercussions of the harms that befall this community really is not just simply because they're using drugs, or the public health implication is also there. And it was mentioned earlier by one of our speakers. Those of us who work in HIV and AIDS, and those of us who work in tuberculosis, for instance, there's a huge impact on how drug use is seen in policy, how policy relegates drug use simply as a crime in this country, and how that negatively impacts effective interventions for HIV and AIDS, for hepatitis prevention, for TB prevention in this country. So it is far-reaching, and I think really research that makes research quite important to give us those insights and to have those communities have the platforms to speak up. Are there studies on drug relapse during the pandemic? Have you encountered this? I think Dr. Dan mentioned earlier about the rise actually in drug use or opioid related
Yeah,
overdose
so
during
mortality
during the pandemic.
has gone up in 2020, both at the intersection between COVID and drug overdose, in a rather stark and dramatic way. As far as doing ethnographic research, I've been grounded for the last year, so I'm looking forward to getting back out and doing some field work.
Dr. Gideon, have you encountered anything related to the pandemic?
Well, unfortunately, I've also been grounded. We did some work with Professor Mary Rosellis and some of my colleagues, Regina Bautista, Vincent Yu, together with Urban Poor Associates. So we had some documentation of what's going on in Manila in terms of the communities affected by the drug war. And the only thing that I can, it's very preliminary, and we haven't really had a chance to go in depth about the drug issue. But what I can say is that the pandemic is definitely a syndemic, in the sense that it's overlapped. The challenges, the economic challenges of the pandemic has definitely overlapped with the pre-existing challenges brought about by the drug war. And people are faced with so much difficulty in terms of family relationships, in terms of finding a job. So these communities have been hard hit by the drug war and by the pandemic. And unfortunately, because of the challenges of the pandemic, we've been blinded in terms of what's going on in the field. But that's also making us realize that as anthropologists, we're not alone. We can definitely work with community members to do this research with us and to also provide updates. So that the pandemic is forcing us to rethink our methods as well. That's another conversation that needs to happen, and it's happening in many parts of the world also, the anthropological methods of being there.
Yeah.
But we will need to keep an eye on that. So that's a very important question, like how is the pandemic is affecting drug use.
Thank you, Gideon, for that insight. I just wanted to throw out that in the past year, we still, not particularly in terms of relapse among drug users, but we still see in the news killings of people who are suspected of drug use. So, the pandemic did not really stem the war on drugs in that sense. What happens to the research after? How do you use it?
Well, I think I answered that already.
Yeah.
Dissemination by any means necessary.
Mm-hmm.
Policy forums, media, academic forums. Back
Yeah.
to the communities that are affected. We try to keep a bilateral relationship going with people that we've interfaced with. But I like this question about building relationship with the
Yeah.
people in your research. Do you want me to read the question? Do
Sure.
you see it?
Yes. So the question is for both of you actually. How did you build relationship with the people in your research? How did you build the trust with them that you are interested in their
And convince them that you're not working with the police. This is actually my favorite question, because it's actually my favorite part of doing the field work. Because our team is flexible. We go to a number of places in the United States. We don't traditionally, what ethnographers do is they embed themselves for a long period of time, and they really get to know the community, and that's wonderful research. But given the fast-moving nature of this drug epidemic that's going on in the States, we are very flexible. We will dive into a community for 1 week at a time, and so we have to build trust. We have to build with the French term entree into that community pretty darn quickly, and it's a challenge every time. It's a challenge to come in to show that you're not necessarily on the law and order side of things, that you're not necessarily coming there to judge, but that you're there. And I think I brought up this metaphor already. I love saying, well, just take a little walk with me. And between here and there, I'm going to ask you questions that nobody else has ever asked you before, and then you decide, right? And the questions I ask them are questions about their personhood, about who they are, and how did they get here? What are they looking forward to? What's the biggest problems of their day? Same questions I might ask in the clinic setting, right? How are things going? What brought you into the clinic today, right? Questions about personhood. And most people are like, oh, well, I've never had a cop ask me that, so you must be different. And the team that I've built, they ask these questions even better than I do. I feel like an old fogey now. They're hip and they're young, and they know how to get people to talk to them much quicker than I do. So that's my answer to that question. It's a bilateral trust building exercise each and every time.
I fully agree with that. The fact that questions are about personhood. I mean, people actually welcome it. I've had some people appreciate, even thank me for interviewing them, saying that, wow, it's the first time anyone was interested in what I think of and what my life is. And it's even therapeutic for some people to be able to talk about things that no one has asked them before in a way that they feel safe about. So sometimes people might fear that, will they talk to me? But in the end, I found that they're more than willing to share their experiences, as long as we've established that your and honesty is also important, like being forthcoming about who you are and what you're gonna do, what your affiliations are. Being honest has dividends in terms of research.
Mm.
Yeah, the problem is not actually, and of course you have to protect their identities. And unfortunately, we haven't really tested the extent to which the government will go after this kind of work. So far, I haven't encountered any problems. But of course, we need to be very careful. So the data, we do not get identifying data. We work with ethics boards to make this possible. So, for example, normally in research, you have informed consent that's written. So we insist that our informed consent is verbal, and we don't have any documentation of identifying data that might be that might compromise our informants, the people we work with. So there's a lot of ethics involved here as well, and it requires a lot of patience to work with ethics boards and other researchers, because it can also be a demanding task to convince people that this is a safe thing to do and an important thing to do.
So Gideon and Mara, let me ask you two a question. And that is, So we do have that experience where people do open up to us, that do want to talk to us, they want to share their stories, right? How do you both deal with the emotional content of that, with the pathos that you hear in those stories? How do you deal with it emotionally?
Yeah. Yes, we ask that ourselves all the time because in my experience in qualitative research, it's always been with people who are marginalized, people who have experienced abuse. So we did well. That's actually it's actually funny. It's funny. It's not, but it's actually also funny. When we were because we documented the stories of 15 people who used drugs who were also affected by the drug war, and when we were analyzing the data, it really made us really angry about when we reviewed the documentation, when we reviewed the transcripts, it made us really angry. How do we cope? We ate a lot, definitely. uh, we ate our anger and frustration. But yeah, it works to have people around us, supportive people we can talk to, people we trust, so that when we vent, we know that we're in a safe environment to talk to them. And I think because the way we do research in Achieve is that, so I like that you were sharing about how you were building trust with the community so they can open up to you. I'd like to push that further in making sure that we maintain a relationship with the community. And one way for us to do that is when we do research, we make sure it's transformed into programs and services so we can continue to engage the community, so that after they give us their stories, they know that they get something in return later on. And it's a new relationship we have with this small community that we are working with at the moment. But you're right. We do deal with the heavy when we listen to all these stories. Something we don't necessarily experience if we're just taking numbers or we're just doing surveys in quantitative research. And yeah, this is, I don't know. Personally, it's just me eating and maybe watching BTS. I don't know if you're familiar with that, but maybe some people in the room are. Gideon, would you like to answer that?
Well, there are two levels that I would answer that. The first being at the level of at the professional level, I think writing itself is
Mhm.
therapeutic. So being able to put to words and to put into writing these the experiences of the people I talk to, I feel is a way of giving them justice. I know it's not complete justice, but it's the fact that I'm able to put them into writing their experiences helps me helps me emotionally to deal with the heaviness, because at least I feel that I've shared what they've shared to me.
Mhm.
And then at the personal level, I really just try to strike a balance between the work that I do and the for example, I do a lot of mountain climbing to help me feel better. And of course,
That's
when I do
healthier than eating.
but when I do these things, like for example, when I went hiking in Peru in the Andes, and they were asking me to take this coca leaf to be acclimatized to the elevation. So it even these experiences build my horizon in terms of what drugs are,
Mhm.
realizing that we've been looking at the drugs in a very narrow framework. Coca, which is illegal, like drinking the tea that I drank in Peru, is illegal in many parts of the world, and yet people do it for acclimatization. In the same way that the people I talk to take shabu to help them stay awake longer in their jobs. So I try to embrace this paradigm of drugs in my whole life, and I think that it's helped me as well, helped me a lot to frame the work that I do. So despite all the challenges, and believe me, someday I'll talk about the full extent of the challenges that I've faced,
Mhm.
including legal challenges. But it's so important for the sake of the people, for the sake of the participant, my research participants, but for the sake of, I think humanity deserves to understand who we are, and drugs as part of who we are. That we've always used drugs in our
Yeah.
everyday life, including the coffee that you drank today. So that kind of openness should be our mantra, should inform us and inspire us to keep going.
Thank you.
Well,
Thank you,
thank
Gideon.
you both. It's been a pleasure being on this panel with both of you.
It's a pleasure to have you as well. Okay, Santa, may I just respond to Santa? She was asking for contact details of Dr. Gideon for a possible collab. I'll let our friends from No Box respond to that. How we can get you two guys to meet and talk about possible collaboration. There is another question. Uh, how do you maintain objectivity with such humane concerns in the conduct of your research?
Well, to quickly reply to that, I think in anthropology, we never claim to be objective. Objectivity is something that is not our goal. Our goal is to
Yes.
really be forthcoming that here's where we stand. This is our positionality. This is our background. This is our motivation. But and based on our engagement, based on our intersubjectivity with people we talk to, people we work with, here are our findings. So the goal is not to be objective, but of course there's an attempt to be fair and to present it as completely, comprehensively, as faithfully as possible. So research integrity also matters, and I think one of the ways to do that in qualitative research is to really bring out as much of what people say as possible, and not bring in your own thoughts, but to invoke people's experiences as much as possible, as 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 vividly as possible.
Dan, would you like to say something
Oh,
about
the
that?
only thing that I'll add to it is that it's all contextual. So yes, I agree with intersubjectivity in the qualitative realm, and it's a very important pinnacle of our work. But we can also triangulate it with local numbers.
Yes.
So I like mixed methods. I can bring in the clinical point of view, I could bring an ethnographic point of view, I could bring an epidemiological point of view. Do they make sense together? Then becomes the overarching question. Or does the qualitative research really rub against the numbers? Do the numbers really rub against the stories? And if they do, we dive back in for more research until we figure out why the stories and the big number story don't line up. But I agree. There's no pure objectivity. We're not looking at bacteria. We're not looking at monkeys in a cage here. We're doing naturalistic observational research, and so we bring our subjectivity to it, and our interviewees bring their subjectivity to it, and we hash it out. I also believe in numbers. Like, we don't do even qualitative research. We deal with smaller numbers, but still you need a certain size. You need 20, 30, maybe 40 voices before the stories start coming together in themes. And so we still look to multiple stories. If one person's telling us the craziest off the edge story, it might get discounted over time when we listen to 29 other people who tell us a more cohesive story. So I'll just leave it at that.
Yeah, thank you, Dan. I think the fact that these researches also undergo ethical reviews would, to a certain extent, provide the necessary measures to make sure that it is not that the research has integrity. But I think that the fact that we choose this particular subjects for our research, and the fact that we choose this particular communities to participate in this research, that already shows some level of subjectivity towards wanting to surface the issues of the marginalized, the unheard. But I like the way Gideon framed it. When we do write the reports, it's not about us and what we think, it's about putting forward what the communities are saying, and that keeps us from actually overwhelming the reports with our thoughts, because we're always conscious of the fact that this is a platform for communities to raise their voices. uh, because it's usually us researchers whether it's anthropological research, we initiate the process of research. We provide the platform for communities to speak. I've been thinking since last night when I was listening to your presentations. I've been thinking about whether there has been any experience of actually providing the communities the opportunity to lead the research, building their capacity so they can document their stories, they can do research among their peers. to me, that's very interesting.
Oh, it does happen. It's extremely challenging, and therefore it's a minority event. But people do it's called participatory action research. It does occur. It's labor intensive, similar to what Chris, the speaker in the session just before this, was talking about in working with criminal justice, public health, public safety collaborations. There's a long conversation that needs to happen up front about whom and how and where and why. And so it's a lot of work. And it doesn't always work well in a funding environment or an academic environment where things have to move a little bit quicker. I believe in it wholeheartedly. I have not been able to practice it a lot because it is challenging.
Yeah, I just want to echo what Dan said, that it's very challenging to do. It's ideal in some settings, and many of the people we work with actually require or expect some form of participatory research component to the work that we do. It's fashionable. It's very fashionable in research to say that it's participatory, but in practice, there are so many challenges. For example, can you find someone who's willing to come out in the community to say that I work? Sometimes we even anonymize the community itself. So to have someone, it entails risk for people to say that I'm a participant researcher in drug use. So there are security challenges
Issues.
involved as well. But it shouldn't discourage us from exploring ways to be participatory in our work. And definitely NGOs, civil society organizations can serve as a link to making this happen.
Yeah, thank you, Gideon, and thank you so much, Dr. Dan Ciccarone and Dr. Gideon Lasco, for uh, doing this session with us. It's been very informative, if I have to say so myself. This has been a really good discussion, and we don't always talk about research, and I know a lot of people are always intimidated by research unless you're academics, who are probably most of the people in the room. But I am one of those who always wanted to encourage and build the capacity of communities to do research on their own. So this is really also my interest. So thank you so much for being here with us. I know that you're both in a totally different time zone, all the way across the world. So this is really much appreciated that you joined us for this session. To the audience, 107 people in the room, thank you so much for staying and participating in this discussion.